Hello, welcome to HLA Live. HLA Live is our regular broadcast on the HLA YouTube channel as well as all the other social media channels. Each week we talk to interesting people from across the HLA community.
Good evening, everyone. I am really excited to be chairing tonight's meeting.
Hi, I'm Rosie Spooner and I'm hosting HLA Live this Wednesday.
And I'm an HLA scholar and I'm also going to be your host this evening.
To share with us their ideas and their innovations and hopefully bring them to a global audience.
Quite quick, we have ideas, let's do this, let's do that. So
many of the topics come from our community, with scholars and faculty expressing an interest in many of the discussions that we're about to have.
Hello everyone and welcome to the HLA Live session on widening participation in the postgraduate realm.
Homelessness and health.
Addiction and the new normal.
HLA programs are built on 6 pillars. The leader is an innovator and entrepreneur. The leader is a communicator. The leader is a manager. The leader as a negotiator. The leader as a follower. And the leader as a philosopher. If you are interested in becoming a HLA scholar, why not get in contact? Many of the episodes in HLA Live will cover one or more of these important pillars. The HLA team consists of Pedra, Eamon, Tim, Riddy, Alistair, Adil and Trisha, and a range of other HLA scholars and faculty.
So this is obviously a really difficult question, and I don't think that better coffee in hospital is going to cut it, but I will try my best to answer.
So the one change that I wish to bring during my healthcare journey is
Hello, my name is David Williams. I'm a HLA scholar and a physiotherapist that works in Derbyshire. The one thing I'd like to change is social care. Now that's a big, huge, complex problem, but I've worked at the interface between health and social care as a physiotherapist, and I really feel passionate that we must ensure that we give dignity in older age. And we must do this for myself, my family, our generations that are getting older. Now this is a complex problem, this is political, this is policy, this is difficult decisions, it's a wicked problem. However, I feel that as a society we need to solve it, at least somewhat, to ensure quality and dignity in old age. And I would like to influence that. I'd like to be involved in those conversations, and I'd like to influence for change. So if I can make one difference in this world, it would be to improve social care in the UK.
I'm wanting us to upgrade the NHS's IT system so we can be more efficient and do less form filling.
I want to make the healthcare system more digital.
A change I want to make during my healthcare career is to make the NHS greener. We know that we need to reduce our carbon emissions, and there are various sources of emissions which we can address. For example, I'd want to see further digital transformation. In the NHS, paper notes are still used in some hospitals. I mean, that's at least the case in Wales where I study, and I would want to see, the cutting back on the use of paper and increased use of digital systems to deliver care. So we would also be saving on printing and postage costs, we'll be helping the environment and saving money for the NHS. Other areas would include ensuring that we're using renewable power sources, also using reusable equipment, and also continuing with the use of telemedicine strategically to deliver care in some situations, because that, for example, cuts down on transport emissions. So those are just some of the ways, but yes, I want to see a greener NHS.
Hiya, my name is Christine Mahota and I'm one of this year's Bristol HLA Scholars and one of the incoming core directors for next year, which I'm so excited about. So the question is, what would I like to change in healthcare during my career? So one of the biggest things that I'd like to change is the stigma that's associated with mental health and mental well-being. We need to destigmatise mental health within doctors, medical students and healthcare professionals, because actually you can have a mental health condition and still be an incredible healthcare professional. Asking for help when you need it, when you feel down, when you don't feel quite right, is not a failure. It's actually a strength, and that is how you build resilience over time. So therefore, I would love to create programs and just slowly start to actually make people realise that if you go and you say, I need help, then you deserve that help and take it, because that will help you become a better clinician, a better medical student, a better healthcare professionals in the long run. So yeah, got a long way to go, but I cannot wait to see where we're going to be in the next couple of years. Thank you so much.
Hi there, my name's Katie Cranfield and I'm an intensive care consultant with an interest in high-risk obstetrics and obstetric critical care. And what one change would I like to make in healthcare during my career? I would really love to help provide some input into addressing the inequalities that women face when they are pregnant, both within a group of patients who are pregnant. There's a significant disparity in maternal mortality between different ethnic groups within the UK. Women who are of black ethnic origin are 4 to 5 times more likely to die than a woman who's Caucasian during their pregnancy. And I'd also like to address some of the inequalities that women face when they're pregnant, compared with women who are not pregnant, in such terms of inclusion in research trials, access to medical treatments and medical care. And if I could in some way, shape or form help to address that, I would really love to do so.
Advancing health equity and promoting spaces for health and social justice.
I want to encourage care that seeks to tackle health inequity, care that considers the whole person, addressing in the wider determinants of a person's health.
As clinicians, we can often get caught up in the daily provision of healthcare. How often do we take a step back to look at the bigger picture? I'd like to share with you some of the work of Dr. Kamara Jones looking at the social determinants of health. I encourage you to listen to one of her talks or read more about this for yourself as well. So the cliff analogy of health represents a period of good health at the top and ill health at the bottom, recognising that the reality is clearly a lot more complex. With unequal access to education, employment, income, housing, transport, food, some will start their lives closer to the edge of the cliff. But we also need to recognise that we're dealing with a 3D cliff. In the same way as there are social determinants of health moving people closer or further away from the edge of the cliff, there are also social determinants of equity, whether that be age, ethnicity, sex, religion, disability. These are all factors that can impact the trajectory along the cliff, where there are different accesses to resources, whether that be in social care, preventative health care, or acute services. If we're going to achieve social justice, we need to address why there are differences in who is found at different parts of the cliff, and why there are differences in the resources at different parts of the cliff. And these are some of the questions that I would like to address during my healthcare career.
What is one change I want to make during my healthcare career? Well, it's got a lot to do with one of the biggest issues facing the world, and that's the healthcare inequities that exist internationally, nationally, and locally. That is to say that different people have differential abilities to access healthcare, different abilities to afford healthcare, and also have different quality of healthcare provided to them. This is obviously a big issue because healthcare is a human right, and the fact that different people have different abilities to access certain types of healthcare or certain quality of healthcare should be a source of concern. And the biggest disparities may not even be internationally. They can exist locally. For example, one part of Glasgow can have very different quality of life and healthcare service provision to another part of Glasgow. But there is a stark disparity between high-income countries and lower middle-income countries. And a big driving force in this is who's conducting the research, who's creating the guidelines, who's basically calling the shots. Guidelines are to do with what resources are available locally and what's present locally, and who better knows that than the people who work locally and the stakeholders that are local. And I think a lot of research is currently being driven by the West, by high-income countries, even when that research is being conducted in lower middle-income countries. Now, there's a variety of reasons for this, but one might just be that the skills needed to conduct these research and how to write papers that can be published in high-impact journals aren't being transferred to the citizens of those nations. So one thing I'd like to do is I'd like to work towards increasing the quality in research worldwide and making sure that low and middle income country voices are just as strong and just as loud as those in high income countries, that they can do research in their own countries by people within their own countries. And there isn't so much of a need to have a high income country funder or a high income country individual come in to do the research. Yes, obviously with income disparity, there may need to be some funding from external sources, but hopefully over time with change, it can be a low and middle income country person holding this grant or this funding application. Thank you very much.
Hi everyone, I'm Nazifa. One change I want to make during my career is trying to improve the access and quality of care that's given to ethnic minorities. I think coming from a Bangladeshi background, I am very aware of the inequalities that we face as a community in particular. And it's something that I want to be able to tackle and address throughout my career. I think in order to tackle this problem, we need to start off with our medical education. We are taught often through pattern recognition, and this can lead to really dangerous stereotypes, so that if you're ever faced with a patient from these minority groups, sometimes their complaints are often dismissed and diagnosis can be missed. I think also in general, I would hope to try to improve things around cultural awareness and also just greater access to things like translators. And if we really want to make that change that I hope to do, trying to tackle some of the racism that is endemic within our NHS.
Hello, I'm Vasily. I'm an academic foundation doctor in West Yorkshire and an HLA scholar in Amsterdam. So if you know me, you will know that I'm a gay man and I'm passionate about LGBTQ plus healthcare amongst many other things. So the one change that I wish to bring during my healthcare journey is increasing LGBTQ plus representation in medicine. Growing up, I've never known of any examples of LGBT healthcare professionals in my life, and during medical schools, I've only met very few people who were open as LGBTQ plus members of the community in their working life. Now, I want to be that LGBT role model in my career as an academic, as a doctor, as a surgeon. I want younger students and trainees to know that these positions in academia, leadership and surgery are open to anyone, regardless of their background, sexuality, gender, sex and so on. I have experienced discrimination and harassment because of my sexuality, but I felt lucky enough that I had the confidence to use these experiences to my advantage. And ultimately, I do know that these experiences and my sexuality have contributed to the work that I produced and the achievements that I've reached. However, I want to change this culture so that other members of the LGBTQ plus community, other colleagues, don't have to experience the same. And this is why I'm an advocate for equality. I also want to provide better healthcare for our patients. I want patients to know about my background because I know that this will contribute and allow me to provide better care for them. And I want to represent the experiences of LGBTQ plus patients. Indeed, I want to improve the NHS by using both my positive and negative experiences as a gay patient for myself. And I want to use these experiences to allow my colleagues to learn how to improve their own care that they provide and to create a more inclusive healthcare. That's what I want to change during my healthcare journey. Thank you very much.
Hi, my name is Laura and I'm a fourth year medical student at Cardiff University, and I'm also part of the London HLA cohort. So in answering the question, what is the one change you want to make during your healthcare career? To that I answer, I want to contribute towards a zero tolerance culture of bullying and harassment in the NHS. I want to see a move away from cancel culture and blame culture, and instead educate healthcare professionals on how to be active bystanders and be proactive in allyship.
Interprofessional working needs to be at the heart of what we do. We need to look at aiming to reduce inequalities, not just within the UK, but on a global scale by working together across the whole of health and social care system. This needs to start with interprofessional education. If we can utilise our transferable skill set, we can make some positive changes to reduce inequalities and tackle them, not just within the UK, but on an international and global level.
Flatten the hierarchy.
The one change that I would like to make throughout my career is to make medicine more accessible as a career path. Equal access to medicine is one thing, but we are far from equal access to becoming a doctor. Traditional mentorship initiatives that help support junior doctors and medical students typically actually exacerbate the educational divide. They provide support and mentorship for people who can afford to pay for it by the hour. I would like to create a strong supportive network for medical students and junior doctors throughout their careers. When I first moved to the UK with my family, we lived in council housing and I struggled to learn English. And then from that to studying medicine at the University of Cambridge and at Imperial College London, where I also obtained my PhD, I've had to overcome many hurdles. I would like to remove the hurdles for other people. In this way, I would like to create an NHS that becomes more inclusive for anyone who wants to become a doctor.
Hello, my name's Ellie. I'm one of the current scholars with the Healthcare Leadership Academy and one of the incoming assistant cohort directors. The main change that I would like to make during my healthcare career is to increase equality within medical education. By that, I mean that I would like everyone to have equal opportunities to attend courses regardless of their background, regardless of their parents' income. I think that unfortunately, much as we focus on widening participation, a lot of that focus is still prior to medical school, and we forget that actually amongst medical students, there is still a great deal of inequality. For myself, being from a family where neither of my parents attended university, I had no access to any doctors in the family or friends. Actually, this made it a lot harder during my initial years of medical school to create those mentorship links and to be able to attend quite expensive courses in extracurricular time to add to my portfolio. So that's something that I would really like to work to change, and I'll be doing that through a medical education career. So I'm looking at going into an academic foundation program with a focus on medical education, and then looking at other ways that actually throughout placements and throughout the clinical years, we can then improve the exposure and opportunities for students of different levels, and not just focusing on medical students, also increasing that MDT approach, looking at physician associates, for example, and increasing our working with nursing students as well. So that's one change that I would like to see during my career.
Looking forwards, the change I would like to make in healthcare focuses in on medical education. This is a place where you can make the biggest difference for medical students before they become junior doctors later on in the NHS. Medical education, there are many ways you can look at it. And for a long time, I think there's been a change that's needed in medical education and the way that curriculums are delivered across the country. A focus on simulation should be the way forwards, in my view. And actually, speaking to fellow medical students, a lot of them really praise the work they do in simulation in terms of developing their clinical understanding of key concepts, but also human factors that play a big part in medicine. And this links into another change that we could really focus in on in healthcare going forwards, and that is the well-being and mental health of junior doctors and medical students in the NHS. I think, again, starting early is the key to success here. And if we can target medical students and improve their well-being and work-life balance from an early stage, then hopefully we will follow that through in junior doctors of the future.
A change I'd like to make in my healthcare career is pushing for more patient co-production in medical education. Patients and those who use medical services should be involved right at the very beginning, from designing curricula, teaching skills, and lecturing. As healthcare professionals, we have a responsibility to be good advocates for patient co-production and patient involvement, and that includes pushing for things like making sure that patient representation is paid equally to clinicians.
So obviously the medical undergraduate curriculum is really full, and all the specialties fight for their own teaching blocks, and we have anatomy, physiology, pharmacology, the list goes on. But I really think there should be room for medical students to reflect on our ideas of identity and incorporate psychoanalytical work in that how we see ourselves. I heard a GP once say that for many doctors, they see medicine as something they are and not something that they do. And I think this can lead to difficult situations when working in a healthcare system that has pressures that lead to system failures, but look for individuals to blame. And that can be from not enough beds, waiting times, delays in diagnosis, and ultimately when a patient dies. And how we deal with that and what we know is and isn't in our control. And I don't think that's taught currently in the curriculum, and understanding and reflecting back and exploring our identity as a collective group, but also individually, can lead to healthier ways in working. When, for example, a patient complaint comes in, this is often challenges our identity as a caregiver or the role we perceive ourselves to hold. And ultimately, we need to understand that we cannot sometimes provide the standard of care that we want, and this doesn't make us bad doctors, and that we make sure that this blame isn't internalised. And I don't think we're currently teaching medical students the reality of the system, of what they're entering, and more importantly, reflecting on what we see the meaning of our careers to be, because when our careers are challenged and our career is our identity, medicine is something that we are and not something that we do. This can lead to mental health problems and tragic cases of death by suicide in physicians. So I think this leads me on to wanting to be in a position to advocate for increased flexibility in training, be that a system that allows for deferred entry at core training, working less than full time out training, and really advocate for a flexible training programme. Because in my opinion, training has been really focused on getting people from point A, the foundation programme, to point B, a consultancy, as fast as humanly possible with as few breaks as possible. And this, I think, works in favour of the system. We have a workforce shortage and crisis, but actually I think there's a lot of benefits we're missing out on in the UK by creating such a fixed system. And I think increasing the opportunities for trainees to leave means they're more likely to come back and therefore help with retention. And I think a system that, for example, penalises you at interview for years taken out, for example, deducting points if you've had an FY3 year, means that people are less likely to take these opportunities to go abroad and learning from other healthcare systems around the world, or just taking a break for life commitments, other life commitments. And overall as well, I feel that it gives the choice. People talk about the illusion of choice, but it gives choice, and not everyone wants to obviously do a master's, take time out, but knowing there is a choice is what gives people the feeling that they aren't being cornered and told there's only one way and only one correct way of doing something. And of course, letting people take time out before they feel that they have to, and then resenting the system for not allowing them to originally take that time out when they wanted to.
The one change that I would like to make during my healthcare career would be that I stop following others' conventional career path and find my own.
If I could change one thing about healthcare, it would be that people working in healthcare feel that they are thriving and not just surviving, and that they go into work with drive and ambition to be the best version of themselves that they could be, and that they feel energised and ready to take on anything that comes their way.
I want to promote medical leadership and management amongst doctors of all levels. In particular, there are so few leadership opportunities for junior and middle grade doctors, with the typical path into more managerial roles being you do your foundation years, you pick your specialty, you work your way up to consultant, and now suddenly there's all these roles such as head of service or clinical director and medical director. But most consultants have no formal leadership experience prior to this point, and they may struggle in their job or even relinquish this new post. In addition, only 1/3 of NHS CEOs have a clinical background, and it's actually these trusts which often outperform ones with a non-clinical chief exec. Over 2/3 of these clinical CEOs are nurses, and there's no reason why these senior leadership and management roles shouldn't also be promoted to doctors to allow us to improve service provision and patient care, but at a more systemic level than as a frontline clinician. So, what would this change look like during my healthcare career? I want to increase the number of leadership roles and opportunities for junior and middle grade doctors, to introduce the idea of management to us doctors at an earlier stage in our career. It would mean senior clinicians would then be more aware of these opportunities and also better prepared when they enter them. It will also help to develop important leadership skills which clinicians don't have training in, ranging from managing a budget to negotiating with multiple stakeholders. As doctors, we already have many of the skills to succeed in managerial roles, such as communication, empathy, team working, problem solving, and working well under pressure. And what we need are more opportunities to put these skills into practice at an earlier stage in our career in a managerial context. One issue that pushes away medics from management is that we feel like we have to give up our clinical responsibilities to take up managerial roles, which shouldn't have to be the case, especially if it is during our foundation, core, or specialty training. I want to establish a framework for a career ladder that maintains both the clinical training of doctors, but also includes these non-clinical managerial learning responsibilities. So, these are just 2 examples of promoting medical leadership and management to doctors, and I hope to enact this change working as part of the Trainee Steering Group Committee of the Faculty of Medical Leadership and Management, or the FLMLM, over the next 2 years.
Hello everyone, my name is Natalia Skorupska and I'm one of the HLA scholars. One thing that I am passionate about is empowering healthcare professionals. A lot of us are trying to make a difference on a local level within the NHS, which is great, but it can be slow and requires a lot of time and multiple discussions with a lot of people, and that is the nature of working within any large organisation. And sometimes you can have a great idea that will save time and money and make a difference to patient care, and the system still says no. So it is easy to just give up on trying to make a change in the NHS, and that sometimes results in giving up on trying to make a change altogether. Spending majority of our time in the NHS bubble, we often forget that we are also individuals outside of the system and that we can do something outside of it. People that go into healthcare are driven, ambitious individuals. They want to help others, they want to make a difference. But the system can exhaust you and you forget about that side of you full of passion and energy that made you go into healthcare in the first place. I want to tap into that side of other healthcare professionals, and I want to make them feel empowered to make a difference and motivate them to lead the change that they want to see. And this is related to the work that we are doing with the HLA Ideas program. We support healthcare professionals to start and grow non-profit organizations that are trying to solve societal challenges. We are working with incredible individuals who are working to, for example, overcome racial and socioeconomic barriers in medicine, support displaced doctors to qualify and work within the NHS, educate healthcare professionals on how to holistically care for patients from different groups and backgrounds. In clinical work, healthcare professionals can make a massive difference on an individual level, so it is so important to get that right. But I think it is also important to appreciate the impact that you can have if you think about healthcare more broadly, thinking of social determinants of health. So that is one change that I want to make during my healthcare career. I want healthcare professionals to see their role beyond frontline healthcare delivery and feel empowered to make a difference on a societal level.
I think on reflection, that's why being part of the HLA is such a great thing, because before you join, you can feel like overwhelmed with how many things you want to help change or things that you care about so passionately. And with that, your projects that translate into helping patients or other medical healthcare professional community in itself. But in our community, you see that everyone has these experiences that you can learn from and build on each other. But we don't work alone on these projects, and being part of the community is what pushes our projects and ambitions to the next phase to achieve our goals. And the HLA has also opened my eyes to many aspects of the healthcare system that members are working on in their projects, and I didn't know about either because I'm still a medical student or I haven't experienced working in these settings yet, or because I'm not directly affected. So I've become passionate about them and an ally to the great work that many others are doing. So I think to finish, I think that if you ask me this question in 5 years when I'm a core trainee or wherever I am, my answer probably still will be better coffee in hospital, but also I think I'll have a greater respect and knowledge of what really is that I want to achieve in my career and how I think I can best apply my skills to help contribute and create a healthcare system we all thrive in.
Thank you to everyone that made tonight's episode possible. Whenever our scholars are thinking about complex problems facing our health systems, we encourage them to think about how they make significant change in the world of healthcare. We are incredibly lucky to have some incredible scholars in the HLA. They use the HLA as a platform to take their ideas and bring them to fruition. If you are interested in the work of the HLA, why not join us at one of our future HLA events? Why not join one of our programs? Why not even become a HLA scholar? Thank you for joining us. My name is Johan Marlwiller, the Director of the HLA, and it's a good night from all of us.